When the blood vessel that carries nutrients to the brain is ruptured by a clot or blocked, a part of the brain can't get blood and oxygen that it needs to function, and that consequently leads to cell death. The brain is a complex organ that controls numerous functions in the body, so when a stroke occurs and there is reduced blood flow to a certain part of the brain, some part or parts of the body that the affected part of the brain controls are not able to function properly. Hello, everyone. Welcome back to our channel. Today, we're diving into a crucial topic that could potentially save lives. We're talking about the signs your body might be giving you a month before a stroke. Yep, you heard that right. Your body might be sending out signals well in advance. Before we begin, remember to consult your doctor for personalized medical advice. So, let's not waste any time and get right into it. 1. Weakness on one side of the body. It is not uncommon for a stroke to affect one side of the body and not the other. If this occurs, the victim will likely have difficulty lifting a leg or arm, may not be able to make a fist, or will have a difficult time grabbing onto objects. The reason a stroke can cause weakness on one side of the body has to do with the side of the brain that was affected. This type of stroke is referred to as hemiparesis. Damage to the left side of the brain will cause weakness on the right side of the body and vice versa. Be vigilant for sensations of numbness or weakness, particularly on one side of your body. This might manifest in your face, arm, or leg. 2. Loss of coordination, unsteadiness. Loss of coordination refers to a difficulty in controlling your movements smoothly and effectively. Unsteadiness is the feeling that you're not balanced or stable while standing, walking, or even sitting. These symptoms can be caused by various factors, some of which are not related to strokes. However, they can also be potential warning signs of an impending stroke, particularly if they're sudden, severe, and accompanied by other symptoms like numbness or difficulty speaking. If you start experiencing a sudden loss of coordination, that is, in one moment you are fine but in the next, you feel dizzy and can't move properly, then don't ignore such hints that your body is giving you. These may be signs of a stroke. 3. A severe or unusual headache. Although this isn't the case for all strokes, in some situations, a certain kind of headache may be an early indicator of a pending stroke. While headaches are common, sudden and severe ones shouldn't be ignored. If these headaches strike abruptly and are accompanied by other unfamiliar symptoms, it's crucial to take heed. Your body might be sending out an urgent signal that demands your attention. While headaches are commonplace, sudden and severe ones are a different story. If these headaches strike unexpectedly and come with unfamiliar sensations, it's time to take notice. Your body might be raising a flag about an impending storm. 4. Confusion. Have you found yourself suddenly feeling mentally foggy or struggling to understand things that were once clear? Mental confusion can be an alarming sign. Reduced blood flow to the brain, a potential pre-stroke indicator, can impact your cognitive functions, leading to confusion and difficulty processing information. Confusion can also become more general. A stroke victim might struggle to understand what is being said to them as well as to talk. They might get confused as to what they are doing at any given moment, and they might be more likely to become lost or frustrated. This can appear similar to extreme tiredness. If you've ever missed several nights of sleep and then buttered your hand instead of the bread, well then this is similar. 5. Slurred speech. It is not uncommon for someone who sustains a stroke to struggle with speech. This is often the result of lost muscle control. The patient may not be able to move his or her lips, tongue, or jaw, which naturally impacts the ability to speak. Often, the speech sounds slurred or mumbled. It might be so compromised that it could become impossible to understand what the person is saying. He or she may become totally incomprehensible. In some cases, the words the person speaks may sound perfectly normal, but they may not make any sense. 6. Extreme fatigue. It is normal to become extremely tired at some points. After all, we all lead busy lives, and at times we simply become exhausted and need to rest. However, if you are experiencing extreme fatigue that cannot be explained, it could be a sign of a stroke. Many people who have had a stroke report that they were feeling fatigued for several weeks or even months before the stroke occurred. If you've been grappling with unrelenting fatigue, even after ample sleep, don't dismiss it. This isn't your typical tiredness. It could be your body's way of sounding an alarm about potential circulatory issues. Reduced blood flow, a precursor to a stroke, might be the underlying cause. 7. Blurred vision. A stroke patient might experience blurred vision and have difficulty focusing. They might also notice other similar disturbances to their vision. In extreme cases, they might experience hallucinations or even kaleidoscopic colors and shapes appearing in front of their face. Our eyes are not just windows to the world. They offer insights into our health. If your vision experiences sudden changes, blurriness, double vision, or trouble focusing, don't ignore them. These visual shifts could be early indicators of an approaching challenge. 8. Dizziness and balance problems. Experiencing bouts of dizziness or struggling to maintain your balance can be alarming. While multiple factors could contribute, disrupted blood flow could be a key player. Your body's equilibrium might be wavering, making this a crucial sign to address. If you start experiencing a sudden loss of coordination, that is, in one moment you are fine but in the next, you feel dizzy and can't move properly, then don't ignore such hints that your body is giving you. These may be signs of a stroke. 9. Elbow pain. One of the symptoms a person may experience before having a stroke is a pain in their elbow. This pain may be quite severe and typically will be on the opposite side of the body from where the loss of blood is occurring in the brain. If you have severe pain in your elbow and you have not recently hit it on something or injured it in some other way, it could be a sign of an impending stroke. 10. Droopy face. Perhaps one of the most prominent and well-known symptoms of a stroke is a droopy face. A person who suddenly has a weakness on one side of their face may be experiencing a stroke. If you are experiencing facial drooping, it is important to seek medical attention right away. A medical professional may ask you to smile or to show your teeth. If there is one side of your face that does not move or sags, it could mean that you are experiencing a stroke. These signs aren't meant to provide a diagnosis but to serve as early warnings that merit action. Your body is an incredible communicator, and it's telling you to take notice. If you identify any of these signs and they persist or intensify, don't hesitate to consult a medical professional. Your health is irreplaceable. If you found this video informative, please give it a thumbs up and consider subscribing to our channel for more insightful content. Empower yourself with knowledge and stay proactive in safeguarding your well-being. Until next time, take care, stay informed, and be well.